Hello everyone, my name is Khalid Al-Majari and today I'm going to talk about the healthcare and the economy. I chose this topic as my sixth current event because I believe this is an important topic to learn, especially now that we are facing a pandemic and we are seeing firsthand the effects of the economy in healthcare. We have seen now economic policies can affect the availability of healthcare supplies and limitation of healthcare workers in the pandemic. This changed the way we are looking at the economy in the healthcare industry. In this presentation, I'm going to talk about the relationship of healthcare and the economy. And then I'm going to talk about the mutualism of healthcare and the economy. And after that, I will discuss the five facts about the economics of healthcare in the United States, which they are the first one is the increase in healthcare spending as a share of GDP. The second one is the United States spend more on healthcare per capita. The third one is the price of healthcare services is are more expensive than other comparable countries. The fourth one is the healthcare administrative cost is the highest is the highest in is compared to other countries. The last one is going to be about healthcare market consideration in the United States continues to be raised. And after that, I'm going to talk about the economic performance of a country that is directly linked to the performance of its healthcare system, and also the impact of economic policies and non-health policies on population health. Finally, I'm gonna discuss the economic uh, opportunities to promote better population health. First of all, I want to explain the relationship between healthcare and the economy. A good healthcare means healthier population that are more productive, that in turn result to a good economy. A good economy enables a country to invest in healthcare and implement policies that make healthcare accessible to all without lowering the budget for other important aspects of the economy. There is always an interaction between health and the economy, just like there will always be an interaction between people's health and their income. Today, the government is investing and spending in healthcare more than any other time in the past. Healthcare is a prime concern because an efficient healthcare system is important for a well functioning economy as well as economic growth. Healthcare plays a big role in the economic performance of a country. An efficient healthcare system matters because of its impact on the economy and government spending. Now we are going to talk about a recent data on the economics of healthcare in the United States to provide a picture of how the economy and healthcare affect each other. Recent data shows that 11% of Americans are employed in the healthcare sector. And at the same time, healthcare accounts for a 24% of the government spending. The first fact is the increase in healthcare spending as a share of GDP. There has been a major increase in the healthcare spending as a share of GDP in the United States. The graph shows that in 1960, healthcare was only 5% of the US economy. And we can see that it was steadily increasing up to 17.7% in 2018. The increase of the role of healthcare in the United States economy is due to different reasons, ranging from increase in prices and increase in usage. It's linked to an increase to the aging population, among others. This graph shows that there will be an increase in the 65 years old and older population. With the increase in the Medicare qualifying age of 65, it's expected that this will contribute to the constant increase of healthcare spending as a share of GDP in the United States. The United States healthcare spending is almost twice as high with the comparable country average. As we can see in the graph, the United Kingdom and Japan spent less than 5,000 US dollars on healthcare per person. On the other hand, the United States spent almost 11,000 US dollars per person for healthcare, which is which is almost like then more than double the amount that the United Kingdom and Japan spent on healthcare per person. It's worth mentioning that even with the low spending on healthcare per person, Japan is on the top countries with the longest life expectancy. In relation to the previous slide, the graph displays that even with the amount of money spent on healthcare, the US does not have the best health outcomes and, in fact, have the lowest life expectancy, the highest rate of chronic disease, highest rate of suicide, obesity, and avoidable death among other comparable countries. This highlights the fact that spending more on healthcare does not guarantee a healthier population. The price of healthcare service in the United States is higher than other comparable countries. This is especially seen in the surgical procedures, prescription drugs, laboratory tests, and other diagnostic tests. For example, we can see in the graph that the price of the prescription drug Kalydeco in the Switzerland is already higher compared to price in Holland, Germany, and UK. But the price is in Switzerland is around 90% of the average price in the United States. High price can be caused by an increased utilization of healthcare, use of expensive and advanced technologies, and higher wages for higher educated and experienced medical team. Administrative costs of healthcare, which involve planning, hospital management, improving the quality of care, and billing and insurance related activities, is not is with no doubt higher than other comparable countries. The data shows the estimated administrative costs in the United States related to billing and insurance in 2019 total to $496 billion. The highest spending is on providers, which includes physician and hospitals. Activities that related to physician administrative costs are incurred during the hiring procedures and monitoring activities for compliance in health industry regulations. In relation to that, it's not surprising to see in this graph that the hospital administrative costs in the United States is the highest as a share of GDP compared to those of other advanced economics. Administrative activities are important in healthcare, but the way the healthcare system in the United States is set up makes administrative activities very complex, and the complexity is associated to the high healthcare administrative cost. Efforts should be made to reduce the administrative cost by simplifying the process and removing unnecessary steps without negatively affecting the quality of care. One of the main reasons why there is a low competition in healthcare and increase in price of healthcare services is because of market concentration. Market concentration happens when a healthcare organization or facility merge into one large health system. It can also happen with the physicians or insurers, but it's especially widespread in hospitals. The graph displays the HHI or Harvendale-Harshman index, which is used by the Department of Justice and Federal Trade Commission to evaluate the degree of market concentration in certain industries. An HHI of 1,500 is an indication of moderate market concentration, and in HI of 2,500 is indicated high market concentration. In this study from 2010 to 2016, all of the players in the healthcare industry are above the moderate concentration, which with the hospital reaching almost 6,000 HHI in 2016. If market concentration continues to increase, healthcare services will continue to be expensive. Now I'm going to discuss further the current relationship between economy and healthcare in the United States. The economic performance of a country is directly linked to the performance of its healthcare system. Countries with a strong economy tend to invest more in the healthcare industry because of how the health of the population affects the economy. The health status of the population is measured by a number of different indicators, such as the mortality and life expectancy, as well as the morbidity and health-related quality of life. To be able to promote a culture of health, it's important that it's important that offers are made to create a balance between investments and policies affecting the healthcare system. Effective economic policies facilitate easy access to healthcare, affordable Medicare, and advances in medical technologies. The US today is struggling to generate a positive outcome in population health despite spending a lot in the healthcare industry. That reflects underlying problems in the healthcare system that money alone cannot solve. Economic policies and non-health policies impact population health, but is not always taken into account. Campaigns to address the lack of collaborations between health agencies and agencies responsible for urban planning, housing, and transportation result to promoting health in all policies. The goal of this policy making method is for policymakers to always evaluate the health impact of economic policies. Through, through the mandate of the Affordable Care Act, the National Prevention Council was established and charged with the coordinating and leading the health in all policies across the federal government. In relation to that, the National Prevention Council create a national prevention strategy, which is a comprehensive collection of policy recommendations across federal, state, and local governments and the private sector. This effort made sure the policies to improve the economy will not damage the healthcare system. It's also important to recognize the small policy changes can have large impact on access to care. An example was the change done in the Affordable Care Act, which is a weakened the protection for people with pre-existing conditions to have the right to avail the same comprehensive health plan as with everyone. Policy makers whose goal is to provide a solution for current issues should be mindful of the long term and the widespread effect of the changes. Furthermore, the ability of economic policies to support healthcare facts that promote better health is important. For example, the campaign to reduce smoking because of the increase in smoking related deaths was supported by economic policies that increased taxes on cigarettes and banned smoking in public areas and workplaces. Collectively, this made smoking more expensive and harder to keep it as an habit. This clearly reflects that sometimes policies can have a greater impact on health than clinical interventions. Clearly planned policies result to an efficient healthcare system, which in turn result to a healthier population. Improvements in population health directly affects the productivity of the population and eventually contributes to a good economy. A strong economy enables the government to invest in healthcare and implement policies that make healthcare accessible to all without cutting the budget for other important aspects of the economy. A high performing economy creates opportunity for the people and drives them to invest in their health. Conversely, the absence of economic opportunity has an opposite effect. For example, the pandemic resulted to the highest unemployment rate in the history of the United States. To cope with the stress of unemployment, people turn to alcohol and other drugs. This is a clear example of how the performance of an economy affects the healthcare population. The conclusion for the presentation is for the healthcare to be more accessible, affordable, and efficient, it's important to address the reasons behind why the United States is spending more on healthcare, but is not seeing good outcomes on the population health. The healthcare system should also put an effort to to reduce administrative costs by simplifying provider engagement, determining if the certain administrative process are up to date, and utilizing common technology platforms to improve data sharing and easier upgrades when it's needed. This is the end of my presentation, and these are my references. Thank you for listening, and I hope you guys enjoyed. If you have any question or a comment, please leave them in the discussion, and I will be happy to answer all questions. Thank you.